And in our first story, the minority in Parliament is demanding the immediate reversal of the dismissal of Dr. Adam Matiku, CEO of the Tamale Teaching Hospital, by Health Minister Minta Akandoh. The caucus says the minister acted unlawfully, violating the Ghana Health Service and the Teaching Hospitals Act, which requires the president to consult the Council of State before such decisions. The minority also condemned the minister's conduct during a surprise hospital visit where he publicly confronted a senior medical officer, Dr. Valentine Akulpa, over the death of a patient. Before we get details from that statement, here's a report detailing the minister's surprise visit and the sack by Michael Ashali.
And lives have been lost. That's why it's blown up. You have that mindset, you will get the expression wrong.
A surprise visit to the Tamale Teaching Hospital 1010s when Health Minister Minta Akandoh clashed with staff over broken down medical equipment. The minister, clearly frustrated, discovered key machines had been out of service for months, even after the hospital spent its internally generated funds trying to fix them.
And then they were able to revive one. We paid them from our IGF. And this is the second thing, the light has gone off. We're running on generator. And we're burning diesel to man the whole hospital.
Just hours before his arrival, a patient had died, an incident that only heightened the minister's anger.
As I speak to you now, we have thanked him for his services he has delivered at the Tamale Teaching Hospital, and we think that somebody else must come and continue as the CEO of the facility.
So he has been sacked?
Exactly.
With immediate effect?
With immediate effect.
Minta Akandoh also announced a tough new policy. Public hospitals must now fix their own broken equipment using their IGF. No more waiting on government.
We are expecting government to either replace it or maintain it. There will be a new government policy directive where a special escrow account will be created for all our equipment.
The minister is expected to pay similar visits to more public hospitals across the country. For Joy News, Michael Ashale.
Well, the Doctors Association of the Tamale Teaching Hospital have been responding in a statement, and according to them, they've observed with concern videos circulating on social media with associated media commentary and reportage concerning a colleague and member of the aforementioned association pertaining to issues that occurred at the Accident and Emergency Department on 22nd April 2025 during the visit of the minister, and they've observed that information being circulated do not reflect the facts as they have on the ground. Now, a colleague who is the head of department for the accident and emergency in his interaction with the honorable minister was asked about the management of a patient who was referred from another facility to the Tamale Teaching Hospital for management. In his attempt to explain the condition of the patient and the challenges encountered in his management, the discussion degenerated and led to some verbal exchanges. We would like to state that our colleague has worked tirelessly to support patient care at the accident and emergency and has always discharged his duties professionally and diligently. The media in its reportage has painted a rather unfair picture to the general public and has tarnished the image and reputation of our very hardworking colleague. We find this to be very unfortunate and an affront to all our members. We call on the media to be circumspect in its reportage of these sensitive issues with concern confidential information of a patient's illness and death and the medical personnel who worked diligently to save him. We believe the interrogation of our member in public was inappropriate. We call on the general public to stop circulating unverified information on social media, as well as stop the wrongful vilification of doctors of the Tamale Teaching Hospital. While we await the outcome of the Committee of Inquiry formed to investigate the matter, the Doctors Association of the Tamale Teaching Hospital would want to reiterate its unwavering support for our colleague who has demonstrated exemplary leadership in his unit and whose only crime was to paint out problems in the facility needing urgent attention to improve care. We stand in strong solidarity with our colleague and will resist any attempt to hamper his ability to discharge his duties. We wish to state unequivocally that if the current trend, where basic requirements for healthcare are unavailable, only for health personnel to be vilified for poor outcomes, we would advise ourselves and take actions that may not guarantee industrial harmony. An emergency meeting of all doctors of the Tamale Teaching Hospital is being organized to consider our options, and that's signed by the Doctors Association of the Tamale Teaching Hospital. Copy the President, the Ghana Medical Association, the Chief Executive Officer of the hospital, the Chairman, the Ghana Medical Association, the Northern Region Division, and also all media houses. And we have a member of the minority joining us on the lines to discuss this particular incident. We're grateful for your time here, Dr. Kingsley. I mean, you, the minority, have called the conduct of the minister into question. Exactly what are your grievances?
Thank you very much, Mami. As you may be aware, we have issued a statement to the effect that the decision of the minister to terminate the appointment of the CEO is very unlawful because the minister is not clothed with such powers to do such termination. As clearly stated in the Ghana Health Service and Teaching Hospital Act. It's very, very clear. He is not clothed with that authority to do what he did.
Exactly which rules is he breaking?
Okay, so you may want to avert your mind to Section 34(7) of Act 525. That says that before you're able to be, it is up to the President in consultation with the Council of State to terminate the appointment of a CEO or any board member of a teaching hospital. For purposes of clarity, the same act even goes on to say in Section 42(2)(d) that such matters should be referred to disciplinary committees of the teaching hospital. So all that we are saying is that it is administratively not consistent with the provisions of the very act that established the teaching hospitals. So it's out of order. And again, in all humility, I mean, rules of natural justice stipulate that people should be given fair hearing. I don't think the CEO was heard in this matter. The whole decision was rash. And we believe that if you want to do public service, it calls for a high level of sobriety. I mean, we can't run things out of emotions. The decision was very rash. And it's a very, very inimical to the work of the health profession. Mami, let's be very honest. Health professionals go through a lot in the delivery of their service, of which all of us, both actors, governors, patients, and everybody contributes to it in one way or the other. There are instances health professionals have to go through extraneous circumstances in the provision of health delivery. And we can't blame them. And for a minister to have an open confrontation with a health worker, I mean, it is the lowest that can ever happen in a public service. Because the health worker is guided and very mindful, and they go the extra mile. The worst that the minister could have done under the circumstances was to call him to Accra to have a discussion with, but to have an open confrontation, the full glare of the public, I say, it's a political spectacle, and it's quite unfortunate. So we are calling on the President, which I know this is not his decision, because there has not been any consultation with the Council of State Act provided by the law that regulates the Ghana Health Service and Teaching Hospital. So this whole thing is null, is void, it's of no effect, and nothing has happened.
Well,
if they really want to risk it.
Well, what I'd like to know from you now is, based on what are you making these allegations, have you at least spoken to the minister or even the people involved in this, especially the CEO who has currently lost his job?
I just read a provision of the act to you.
I understand that.
I listened to the interview granted by the minister.
Indeed.
And he said he has revoked.
So,
and we are saying to you that the law does not allow him to revoke.
Agreed.
So,
but what I'd like to know from you, what I'd like to know, at least he's been a member or even still a member of the committee before, even ranked on that committee before, and I was hoping that you might have even spoken to him to at least hear his side of the story.
That even makes it work, because he's very much aware that the Parliamentary Select Committee on Health is embarking on its routine annual health on-site inspection, of which the letter that went to announce our presence was copied to him. It was written to. He's aware that the team that I'm in, we are in Bolga now, will be at the Tamale Teaching Hospital on tomorrow Thursday. So why the rush? We are not saying that he can't exercise his executive monitoring or whatever. As a ranking member on this particular committee, I believe that if we were a bit sober and be more patient, he could have referred issues to the committee so that when the committee gets the facility, we can have a more convivial interaction with the health workers. Well, I mean, what is very dangerous is that if these things are not nipped in at its minimum level, we are exposing the health sector to a very distasteful political spectacle that will reduce the morale of the staff. Let's say, touch wood, in the course of the outburst, if he had a cardiac arrest at the facility, who was going to take care of him? Exposing these medical professionals, people who have distinguished themselves, provided very essential services to the people of the northern region and other regions that come in contact with their facility or service. Within a twinkle of an eye, you said, I've sacked you. When you don't have the authority to do so, we are saying that immediately, I mean, nothing has happened. It's of no effect. The guy should go back to his work and do his work, because I don't think His Excellency has consulted the Council of State.
Well, Dr. Casey, hold your guns for me. We have Alhaji Suhuyini on the line with us as well. He was there when the incident happened. Let's hear from him what exactly happened. We're grateful for your time, Mr. Suhuyini. Tell us what happened, what transpired over there. You were there with the minister.
Mamedi, thank you very much, and good morning to your listeners and viewers. Good morning to my honorable colleague on the other line. So yesterday, the Minister of Health arrived in Tamale to pay a surprise visit to the Tamale Teaching Hospital, following recent agitations by members of the community over the death of a young 31-year-old gentleman who many in the community believe could have been saved if some more attention was given at the point that he arrived at the emergency ward. They have actually started a campaign, and if you monitor on social media, asking for the hospital to be fixed, because that wasn't the first time similar cases had come to the attention of the general public. And many have complained about the conditions of service that is actually usually extended to members of the public when they visit the clinic. So based on these concerns, the minister arrived yesterday to pay a surprise visit to the hospital to assess for himself what the issues are. He invited me as a member of parliament in the region to accompany him. And fortunately, I was around, so I did. When we arrived, the CEO of the hospital with other staff met us and began to take us around the facilities. The minister decided to assess the facilities firsthand before having a management meeting with the management of the hospital. And on our round, we got to the emergency ward, the red zone, where we are told the recent incident happened. So the minister asked for a briefing on how the whole incident happened. The doctor who was on duty, who is not, by the way, the CEO, because there's a misconception out there that the person who was seen in the video arguing with the minister is the same person who has been sacked as the CEO. But the CEO was not the doctor seen in the video, in that altercation with the minister. The doctor on duty, who is, I'm told, in charge of the red zone of the emergency ward, Dr. Valentine, I'm told that's what his name is, was asked to brief the minister on what happened that day. Now, in his briefing, he was very eloquent about the problems that they also faced and the efforts that they made on the day to save the life of the gentleman. Unfortunately, in the process, he made a remark that personally I found unfortunate. He said, and I quote, "I don't even understand why this mark," referring to the loss of life, "is being blown out of proportion." So at that point, I intervened and I said, "Doc, you can do all the narration, but don't refer to the incident as one that is being blown out of proportion."
You mean the doctor made the statement?
Exactly.
Right.
And that's when I intervened. I was the one who intervened. Right. And I said, "Doc, you can tell us what happened, but don't refer to this incident as being blown out of proportion. Because one life lost is enough to be blown out of proportion so that measures can be taken to prevent other lives from being lost." That was my caution to the, very celebrated doctor in the hospital. Unfortunately, he insisted. And, the minister calmed me down and asked that we leave the scene. His CEO asked him to stop talking. That is the doctor. He asked the doctor to stop talking. But he kept on insisting that he didn't understand why this was being blown out of proportion. So the minister asked us to leave the place. So we started walking away. But this doctor kept talking. So if you watch the video, you see that the minister turned back and now accosted the doctor and said, "Oh, doc, that's why we are telling you to be sensitive. But if you are still talking towards your superiors like this, then it tells me that the ordinary people, even when you are going to speak the truth to them, you will not do it nicely. That is why there's a problem in this hospital." And that is exactly what happened. And so we walked away after the minister had told him that, "Look, if you are speaking towards your superiors this way, and you even take advice from us that you should not refer to this matter as being blown out of proportion, then it tells me that you will not have the patience for ordinary people who come to this hospital, and raise one question or the other." That gives me the impression that there is really a problem here. And then we walked away. And up till today, I do not know of any administrative measures that have been instituted against the doctor. Nothing, no caution, no harsh word or suspension has been meted out to the gentleman.
Well,
all that happened was that after this, inspection tour, we went to have a management meeting with the hospital management. And then the minister returned to Accra. And in consultation with His Excellency the President, the decision was taken to relieve the CEO of his post. And so that nothing to do with what is being circulated on social media. And the suggestion that it is the CEO who was in an altercation with the minister and because of that he has been dismissed is completely false.
So there was a consultation with the president, but do you think, in your own opinion, that this should have warranted the sack of the doctor?
I do not think that what happened had anything to do with the dismissal of the doctor. The doctor, or which doctor are you referring to?
The doctor who has been sacked currently.
No, that is the CEO who has been sacked. The CEO is
Dr. Atiku, right?
Position.
Right.
Yes, he's a doctor too.
Yes.
But I'm saying that there are two doctors here. That is misconstrued. Some people think that the doctor who was in the video in the argument with the minister, who is the CEO who has been sacked, he has not been sacked.
Right.
No disciplinary measure has been instituted against him. It was just a caution that the minister gave him that, look, if you are speaking to me, your superior like this, it gives me the impression that you will speak worse to ordinary people when they come there. So don't be doing that. And then walked away. He has not asked for any disciplinary measures to be taken against that said doctor. But as for the administration of the hospital, having assessed the situation at the hospital, the minister was of the view that there will need to be some changes at the top management level of the hospital, starting with the CEO. And the CEO is, as for CEOs, they are appointed sometimes every 4 years. I think that's what the law says. And sometimes the contract are extended and all of that. It's a contractual arrangement between the teaching hospital and the employer, in this case, government. And so any decision could have been taken. In fact, the CEO could have even been, fired long before this visit or long after this visit. It just so happened that the minister thought that it was an opportune time to use this grievances of the people in the community to begin to retool and reset the hospital, starting with the dismissal of the CEO and asking him to hand over to a new acting CEO. And also subsequent measures that I know will be taken to ensure that the hospital works to, save lives, because that is the purpose of the hospital. And trust me, the minister, even in his address to the media after the management meeting, made it clear that he appreciates, and we all do appreciate, the sacrifices, the sacrifices that these health workers make, and the difficult conditions under which they work. But the point also has to be made that those difficulties and those sacrifices should not, lead them to become insensitive to the plight of the people who seek their care. Because you see, for all you know, the patients and the relatives who come to the hospital to seek medical care do not know the conditions the difficult conditions under which you work as a health professional. So when they feel that you could have done better, it is up to you to find a nice way of letting them appreciate your effort and not to dismiss their concerns and their grievances. And that is what we sought to draw the doctor's attention. That look, you are right, there is a need for ventilators to be provided at the emergency ward. There was a mobile ventilator at the ICU, which the minister thought could have been used in the meantime to save the person's life. But that didn't happen. But the lasting solution is to make sure that the emergency ward also has its own ventilators. And you are right in stating, the deficiency and the need for that to be rectified. But don't say you do not understand why the matter is being blown out of proportion.
Well, Mr.
A very
Sweeney,
harmless, simple caution like that shouldn't have led to the reaction that we
that happened.
That very hard-working doctor.
So, for clarity's sake, the CEO was sacked because of the deteriorating conditions at the hospital. Has nothing to do with the altercation between the other doctor and the minister.
Absolutely, absolutely. It has absolutely nothing to do with what happens at the hospital. Like I'm saying, the minister has not asked for any disciplinary measures to be taken against the doctor that you find in the video arguing with him. Nothing. Because, look, it is acknowledged that he is a very hard-working doctor who makes a lot of sacrifices. And it is appreciated that perhaps his frustration was stemming from how hard and how much he works. And yet, when this incident happens, it begins to look like, they are not doing their best. But it was just a matter of drawing his attention that, just as you want to be appreciated, you should also understand that people have lost loved ones and they will be sensitive when you say you do not understand why the matter is being blown out.
So are you suggesting...
That has absolutely nothing to do with the firing of the CEO. That is purely an administrative matter that would have happened either before this altercation or long after it.
So are you suggesting that this doctor that, quote or unquote, talked back roughly to the minister should be disciplined?
Absolutely not. I don't think so. I don't think he should be disciplined. He didn't do anything wrong, in my view. All he did that I found unfortunate was to make reference to the matter as one that has been blown out of proportion.
All right.
And I think that was just a mixed communication on his part that I was hoping he would take on board and continue with his hard work and his sacrifices. I do not think he did anything wrong at all for which he should be disciplined.
Right. Well, Dr. Kingsley, you've had the facts laid bare before you by Mr. Suhuyini. What do you have to say to this? There was consultation with the president before the sack was effected. What do you say?
So, hearing from my colleague, and a very good morning to him, all that we are saying is that the provisions of the law that regulate Teaching Hospital is very clear. And we think that we are of the opinion that it was not followed. Due procedure was not followed, the president was not consulted, or if the president had consulted the Council of State, the doctor in person of the CEO, this thing would have been fought. If they want to make it like a coincidence where that of the CEO is different from the neurologist who had issued the minister, that is up to them. And what we know is that, as stipulated by the sections of the article or the law that regulates them, the Council of State has not been consulted, and that the minister is not therefore close with that power to issue the tax.
So that's all that we respectfully, that my colleague know if the president has been consulted. Does he know for a fact?
And if they are
well, that's a question to you, Mr. Kingsley. He's telling you,
just guessing, or he knows for a fact.
Dr. Kingsley, kindly hold on. Mr. Suhini, kindly hold on for me. Yes, and I'll put that question to him. Dr. Kingsley, Mr. Suhini is asking, do you know for a fact that the president wasn't consulted or the Council of State wasn't consulted on the matter?
Yes, I checked revealed that. And the coincidence is too coincidental. If they are telling us that yesterday the thing happened and the minister communicated the decision of the president in the evening, in the afternoon. So at what point were they going to inform the CEO if that issue had not happened? At what point? At what point? The minister came from Accra to Tamale. So it was carrying such a decision. That couldn't have been communicated before the on-site visit.
You know, Mamezi, I can help my honorable colleague. I appreciate where he's coming from. But the point is that he is well aware that the boards of these hospitals are being constituted as we speak. And that constitution didn't start yesterday. He knows that in constituting the new boards for these hospitals, there will definitely be consultations between the minister, the president, and the Council of State. And these things don't happen in a day. But yes, the decision to announce board members, the decision to announce the placement of CEOs will happen in a day. But the processes that will lead up to it will not take place in a day. And so if it coincided with the announcement to release the CEO coincided with the event of yesterday, it is forgivable.
But if Mr. Suhini, if the consultations are still ongoing, then at which point did the president give the order for him to be sacked? Because that would be prejudicial, isn't it?
I'm saying that the consultation to form the board and to appoint CEOs, where there is a need to appoint CEOs, have been ongoing since President Mahama was sworn into office. It's been ongoing, and it's not just for teaching hospitals. It's for all state agencies.
Indeed.
So at every point in time that one is ready, it is announced. And that's what I made the point earlier, that this decision could have been announced even before the minister's visit or long after the minister's visit. Like I said, it is forgivable to wonder why the announcement was done yesterday to coincide with the minister's visit. It is forgivable to...
So are you saying that decision was taken way before that?
Anything away from it.
So, Mr. Suhini, what I would like to understand is whether that decision to sack the CEO was taken long before the minister went to the hospital or after his encounter with the CEO at the hospital.
As someone privy to the consultation processes that have been taking place, I knew long ago that the CEO will be replaced. I did not know when. I did not know how. But we all knew that the state of the hospital required that new management took over and brought on board new ideas. That I'm well aware of.
Right. Okay. So, Dr. Kingsley, what's the next step for the minority concerning this situation?
As well communicated in our statement, we have to support our health system. We have to protect the vulnerable, and we use every available parliamentary power within us to make sure that there's fairness, people are treated fairly as is due them. Because my colleague was making reference to a board. And the very law doesn't even make reference to a board. For terminating purposes, It is in consultation, the President consults with the Council of State, which we are reliably informed that has not happened. So if they are attributing this whole thing to coincidence, then we're looking at our best judgment. And the minister carried the information, the announcement received from Accra, and decided to hold on to the vote to Tamale, and this unfortunate incident happened. We are not saying that people should not be disciplined. The same law provides when there are disciplinary issues, that one must follow. So all that I'm saying is that after I heard you that the Doctors Association of Tamale has issued something. This is a network. This is a chain. We have to be guided and make sure that people have the morale to go the extra mile.
Right.
That's all that we are saying. It should be reinstated.
Great. Thank you very much, Dr. Kingsley, and also Honorable Sweeney. We are grateful for your time on our desk. And moving on, the African Union representative for silencing the guns, Dr. Mohammed Ibn Chambers, is asking the Alliance of Sahel states to coexist within the larger ECOWAS family. He emphasizes that what is important is maintaining collaboration between the two bodies. He has also been assessing ECOWAS 50 years after its establishment. He spoke to Presidential Affairs correspondent Maxwell Agbabo on the sidelines of the launch.
We're coming to you from the foyer of the Accra International Conference Center, where the launch of ECOWAS 50 is taking place. Right after that, we'll also have the meeting of the Council of Ministers, extraordinary meeting of Council of Ministers of ECOWAS. And key on the agenda will be the withdrawal of Burkina Faso, Niger, and Mali from ECOWAS. And they'll be having deliberations on that. But we're privileged to have here with us a top diplomat here with us. He's going to help us with assessment of the ECOWAS at 50. Let's speak to him now. Dr. Mohammed Ibn Chambers is our guest. Let's speak to him. His Excellency, you're welcome to JoyNews.
Thank you.
And glad to meet you.
Thank you.
Great, great. First of all, let's start with ECOWAS at 50. What would be your own assessment of the regional bloc?
No, I mean, this is a momentous occasion. 50 years in the life of any individual institution is significant. It's a moment, of course, of reflection to look back 50 years and see what has been achieved, what the challenges are, particularly contemporary challenges, and then think together, the whole region, members of ECOWAS, and see the next steps forward in terms of really rejigging the organization, resetting the agenda, and trying to meet the challenges of the moment. But over the last 50 years, there have been some significant achievements of ECOWAS. The most significant, of course, relate to the protocols on free movement. Ours is the only sub-region in which you can move around without visas. That is quite significant. And in that context, it's designed to also help us achieve the original agenda of the organization, which was to build an economic community. You cannot have an economic community if people cannot move around in the region to do business, to take opportunities, take advantage of the tremendous opportunities of our West Africa sub-region. So that's one particular area in which there has been significant achievement. Okay. But on the other hand, in some of the infrastructural areas, for instance, not many people realize that West Africa is completely interconnected in terms of the electric grid system. We're all interconnected, and this is from ECOWAS projects on energy, cooperation, interconnectivity. We have improved a lot of some of our regional infrastructures, also roads and other means, and there's still work to be done, but these are achievements we ought to be proud of. Also in the area of governance, some basic protocols have been adopted to guide countries in working towards good governance, deepening democratic governance, accountable governance. It's work in progress. So we have something to celebrate over 50 years, although the challenges today seem overwhelming.
You say that although the challenges seem overwhelming, for some people, they think it's all doom and gloom, but clearly you've enumerated, listed some successes of ECOWAS. One clear challenge that ECOWAS is facing now is the threat of disintegration, with Niger, Burkina Faso, Mali now establishing the AES. We've seen what President John Mahama is doing to bring them back into the fold of ECOWAS. I want to find out from you what you make of that move by President Mahama right after he was elected, embarked on the Good Neighborliness tour, visited these three countries, as well, to have discussions with them. What do you make of that move?
Well, the challenges that led to the three countries withdrawing are well known. They relate to the existential threat of terrorism that they face there, which has indeed resulted in coup d'etats in all these three countries. And perhaps the region did not exactly have the wherewithal to come to the assistance of these countries to deal with the fundamental challenge to even the very existence of their statehood, which is the fight against terrorism. On the contrary, it seemed to be that there was too much demand on them to go back to elections. So perhaps there wasn't a right balance of issues there. But the fact is that we are one West Africa region. Our people have lived together over centuries. So ECOWAS was just a formal organizational form of expressing what has been a historic reality in West Africa. And I have always thought that it is not mutually exclusive to have subsets of countries working towards integration within the wider ECOWAS family. In fact, already you have Mano River Union, a number of countries, 4 countries who work together within that context, but they remain members of ECOWAS. UEMOA, 8 members of Francophone countries in West Africa, they collaborate on monetary union and other things, but they remain within ECOWAS. So the AES can exist within the ECOWAS family. And so therefore I think that the policies and the steps that President Mahama have taken are in the right direction. These have been encouraged by especially the chair of ECOWAS, and I know also President Ouattara encouraged him in that direction. So let's see how ECOWAS heads of states working together. I know that President Diomaye of Senegal, President Faure of Togo have been designated to encourage a rapprochement. So together with these strong initiatives on the part of President Mahama and the Ghanaian government working to maintain collaborative and fruitful relations with these countries, that
Well, on our Climate Focus series, we explore the critical nexus between climate-induced migration, peace and security. Our spotlight turns to the northern parts of Ghana, where we have the first look on the effects of climate change as it extends beyond environmental concerns to impact livelihoods, employment and regional stability. The report, produced in collaboration with our partners at the Youth Bridge Foundation, delves deeper into these pressing issues.
In the heart of West Africa, beneath its burning sun and upon its parched earth, a story of survival, conflict, and the quest for peace unfolds. This is northern Ghana, where the consequences of climate change are not just statistics, but stark realities that shape the destinies of its people. The Fulani and nomadic people and the Dagombas, farmers rooted to the land, find themselves at the crossroads of tradition and the harsh realities of climate change. Dams that once sustained life have dried up, leaving behind more than just barren land.
In the dry season, the little water remaining in the dam for us to use becomes muddy making it difficult for us to use it. The dam used to be deep with clean water, but with the dirt in it now, it renders the water dirty, even if the quantity is much. As people fetch the water, some fetch it home for their animals to drink, but we ourselves do not have a clean source of water to drink. But we have no other option than to also rely on this water for drinking and cooking.
For the Fulani, migration is not a choice but a necessity. As water becomes scarce and grazing lands vanish, they move driven by the ancient rhythms of the earth and sky. But their journey is fraught with challenges.
The only source of water we have is the place where we are, the small dam we can use to harvest some small water. It will take us, after when the rain stops, it will take us maybe 1 or 2 months. Then it will finish. After that, we will not get any water unless we move to different places and get water for we ourselves and our animals. Because of we are suffering of getting water, so that's the reason why our father, he said we should organize some small amount so that we'll get people to come and help us to redig the place so that we harvest more water.
The arrival of the Fulani and their herds in Dagomba land sparks conflict. Lands once fertile are now battlegrounds, where survival is pitted against survival. Both sides bear the scars of this clash, with stories of loss and longing.
One day I was there when somebody calls me. The cattle are inside my maize farm. So I went and they already go outside the farm. So I chased them with motorbike. I couldn't be able to meet them. But fortunately, I met their owners coming to the roadside. So I talked to them. Then they went back and saw that it was their cattle. So they came to apologize to me, so to forgive them.
Their intention is that the grass near the farm is very softer than where they are grazing every day. So they plan to come at the day you are not in the farm. They will come and graze at the edges and enter inside your farm and graze.
There are times my head disturbs other people's farms. The reason is because the population is increasing. Places where our cattle used to graze has now been turned into farms, and cattle would always graze in those places now, and sometimes they walk into people's farms. But the reason we've stayed here for long is because we are patient, and as much as possible we try to talk and negotiate